my friends. This is Dr. Diana. I am both a doctor and a patient, and I am pretty ill. And I wanted to share with you today my thoughts on the relationship between multiple sclerosis and Ehlers-Danlos syndrome, or EDS. Ehlers-Danlos syndrome kind of sucks. The overlap, though, in the symptoms between these two conditions was one reason that I considered CCSVI for my Ehlers-Danlos. So, first, know that I do not have a diagnosis of MS. I have one brain lesion, no spinal lesions, at least that they can find, but chatting with my EDS friends, many of us noticed how many of our symptoms overlap. Now, as years went by, I've been sick for about 7 years now. The symptoms became more and more like MS, and indeed, many of my EDS friends and I were talking about it, and so many were diagnosed eventually with multiple sclerosis. So I think that's more than just a coincidence, don't you? Now, what are the chances of having two very rare conditions simultaneously in the same person, I asked. But one thing about being a sick doctor is that there are opportunities to rub elbows with researchers, and it was at a lunch that I heard from one researcher that too many Ehlers-Danlos patients go on to develop multiple sclerosis. So I came across an article, you'll find it here, that says there's a 10 to 11 times increased prevalence of EDS in multiple sclerosis patients compared with the general population, a link. So for that reason alone, my MS friends, I'd highly recommend that you are screened for EDS. You may be able to learn enough from this site to have an idea if you fit in the EDS space. I'll give you lots of pointers on trying to figure this out in some of my other videos. But if not, you'll want to go to a geneticist who is very familiar with EDS. It's very possible that if you do not have EDS, or rather that if you do have EDS, the MS medications are not what you should be taking, okay? So what symptoms did I or do I have that sound kind of MS-ish? Happy to say that many of these symptoms are greatly improved. Some have disappeared and come back. Some I managed, and I'll try to tell you everything, okay? Meanwhile, these are some of the things I've dealt with that sound MS-ish. Lack of balance. Now that kind of sucks, but I also have orthostatic intolerance, meaning I have trouble staying standing without everything kind of giving out. I have right leg clonus and very loose joints, so I kind of blamed it all on that. Muscle spasms, yes indeedy. These can occur any place on my body. I even have those MS hugs. I didn't know that's what they were called at the time, but I understand that's what those are. So, numbness, tingling of my hands, fingers, left hip, tongue, as one friend said, pins and needles, but that really wasn't right to say pins and needles. You're being such a pig, it should be pins or needles, so I thought that was kind of cute. One scary symptom that I was developing that I'm happy to say did go away, hopefully it's not coming back, about 3 weeks after CCSVI, my right arm and right leg stopped the feeling of dragging a toddler around with them. Okay, I had that feeling going on, so I ditched the toddler, yay. Now I do have a tremor. It's worse on my right side than the left. It's also worse in the morning. It looked like I had Parkinson's when I first got up and reached like to turn off the alarm clock. That is no exaggeration of the amplitude of that tremor. It was always worse in the morning, which I think was a clue to what was going on. Eye discomfort, very dry eyes, almost overnight. Changing vision too, and it felt sometimes like my eyes were going to pop out of my head. And being an eye doctor, I will help figure this one out, okay? I've got a good running start on it. Now, there are reasons for vision changes. It can be from the corneal problems, say edema or swelling, to the lens, retinal edema, optic nerve defects, or any neurological problems from the retina all the way back to the visual cortex in the back of the head. So we'll figure this one out, okay? Now, please consider participating in some of the preclinical trials on ocular effects on this website, you'll see. These are for MS or EDS patients, or both. Now, if you or someone you know lives near Texas or we pass them through, we'd love to have you participate. One of them also is for anybody, any place. It can be done right over the internet. Okay. Facial pain. On the right side of my face, behind my right eye was where it was worst. Now, interestingly, on my fMRI before angioplasty, it indicated I had a very dilated vein back there. I'm wondering if that's related. Brain fog, anyone? Oh, heavens. Poor attention span. I remember I couldn't recite the Lord's Prayer. I thought I'm just going to start, Our Father, and I would just drift off. And I would try to do that maybe 10 times in a row. I could not complete the Lord's Prayer in my mind. Memory loss, aphasia, having trouble finding the right words, definitely me. Difficulty reasoning and solving problems, they call that loss of executive function. Now, remember, I'm kind of an overachiever, a doctor. I have a fairly high IQ, but I couldn't even make a to-do list. I could not do 3 things on a to-do list. It's horrible. Depression, indeed, even suicide ideation kind of comes and goes, like somebody flips on a light switch. I knew that was chemical because it stopped just as quickly as it would start, and it would come in spurts. But I thought I'd be taking very seriously in the studies that, yes, it involves brain chemistry. You need to look into that. But because I'm a doctor and a woman, I thought maybe the doctor thing would override the woman depressed thing. No, your label is kind of a depressed woman and your other symptoms go out the window, so heads up on that one. Dizziness or true vertigo. I have had both and continue to have more dizziness. My speech was slowly being affected. I noticed it seemed like my tongue was too big for my mouth. I had trouble with my S's unless I slowed down and tried to enunciate also. My speech was slower. I thought it was normal until I went back and looked at some videos, and it wasn't normal at all. Abnormal nerve reflexes, yes, waist below. I was hyperreflexic, still am. So you can see I was looking at possible correlations between these 2 conditions. But I wasn't really getting anywhere until it felt as though the pressure in my head was too high. My eardrums started to hurt. I had a constant occipital headache in the top of my head, radiated down my neck into that angel wing pattern. I believed I developed CSF rhinorrhea, this stuff leaking out my nose, I believe is brain fluid. Any Valsalva maneuver, like blowing a flute, blowing up a balloon, lifting a weight would make it worse, especially the tremor and especially the leak. So I tried Florinef at one point, which is a treatment for POTS. It increases your blood volume, and that made that occipital headache 1,000 times worse. So I knew I was dealing with higher pressure. Ditched the Florinef, grabbed Diamox, which reduces pressure inside the head. Got immediate overnight relief from that. So I knew we were on a mission with this pressure issue. All eye doctors have some expired bottle of Diamox in the back of their cabinets because we use it for emergency closed-angle glaucoma patients, but you hardly ever need it. So it's usually expired, but when you need it, you really need it. So I downed a couple of those. Don't try this at home without it. Okay, but wow, what a difference did that make. So here we go. This is what led me eventually to CCSBI, which did help me, but it did not help my son, and I think I know why, and I will share that with you too. Meanwhile, if you have been diagnosed with MS, please look into Ehlers-Danlos syndrome, and my EDS friends, I will do everything in my power to prevent you from developing multiple sclerosis, okay? We're going to change this world one brain cell at a time if we have to. Until next time, gentle hugs.